Now, I'm sure you didn't know this, but today marks World No Tobacco Day, where the World Health Organization are encouraging governments to work towards stricter regulations over smoking.
The Health Secretary is expected to publish a report on the tobacco industry as part of ministers' ambitions to make the UK smoke-free by just 2030.
Well, the Tobacco Control Plan, it's going to be published later this year, is expected to suggest that the legal age to buy cigarettes should be increased to 21. Would that actually help? Dr. Frankie Jackson-Spence joins us in the studio. Thank you very much. How many young people really are smoking and smoking really young?
Well, you would think that now we're more educated on the health risks of smoking, that less young people would actually smoke. But stats show that of the 6 million people in the UK that still smoke, the highest proportion of those are actually in the young age group, so the 25 to 34 age category. So that's actually quite surprising. And since the first COVID lockdown, 25% increase in the number of 18 to 30s who took up smoking. So young people are still smoking, unfortunately.
I mean, the bottom line is with this, I can understand it. I used to smoke. I can totally get it that at that age you just feel invincible. Yes, there are health risks, but it's down the line. It's something you think about later.
Yeah, I think that people really do need to be clued up on the health risks. You know, the list is actually endless. Smoking increases your risk of over 50 different health conditions. And people think that it's just lung cancer. So smoking causes over 70% of lung cancers. And that's the one that people are afraid of, but they think it's going to happen later in life. So you're right, young people don't worry about it so much. But actually, smoking increases your risk of many other conditions. If you smoke 20 a day, you're 5 times more likely to have a heart attack, 6 times more likely to have a stroke. It's not just heart disease and cancer as well. Smoking can impact your fertility, your ability to carry a pregnancy to term. So it is something that young people should be aware of.
It's very bad for the skin.
It is very bad for the skin. It can increase skin ageing and make you look much older than your years.
It has really fallen out of fashion, though, hasn't it? You know, long gone are the days where you can't even remember that you'd go into a restaurant and you'd request smoking or non-smoking. That must have done real benefits for our public health as a whole.
So the trend in smoking rates has declined since all of these initiatives, you know, particularly since smoking was banned inside in restaurants. But since the COVID lockdown restrictions and everything, smoking rates did slowly incline again. So I hope
Why do you think that is?
I think people were at home more and turned to comforts a lot in times of anxiety. You know, smoking can be a habit that relieves a lot of people's anxiety and is a comfort to them. Same with alcohol. So I think that people did turn to some unhealthy behaviours during those stressful times.
What about vaping? Because what I find very confusing about the whole vaping thing is now that in places where you can't smoke, they lump vaping in with that, so you can't smoke or vape. So people tend to think that they're in effect the same thing. Vaping is a lot healthier, isn't it?
So vaping is significantly healthier than smoking, but it's not risk-free. So while smoking contains about 5,000 harmful chemicals, the most dangerous being tar and carbon monoxide, vapes still contain some harmful chemicals, but not those most dangerous too. So whilst I think that vaping and e-cigarettes are a useful stepping stone to stopping smoking entirely, and you are more likely to quit, twice as more likely to quit if you use a vape than going cold turkey, it's not risk-free. So I wouldn't encourage a non-smoker to take up vaping.
How would you encourage the person watching at home or listening this morning who just says, I've tried to quit, I've tried and I just can't?
So I would definitely recommend actually getting support. Stats show that people who reach out to their doctor and use the NHS smoking cessation services are twice as likely to remain smoke-free. So definitely reach out for support. Tell people around you what you're trying to do. So it helps take you out of the environment where you may be more likely to smoke. And I think habits are a really interesting kind of psychological phenomenon, and actually replacing the habit of smoking with something else can increase your likelihood of quitting. I think also nicotine is one of the addictive chemicals in cigarette smoke. So replacing that with things like nicotine replacement patches or gums can also help you be successful with quitting because it helps reduce the withdrawal symptoms. So reach out for support. There's a lot available there.
Yeah, it's a very, very hard thing to do. Dr. Frankie, thank you very much indeed. And I think one of the key things is if you give up smoking and then you have a cigarette, don't think, oh, that's it, I've blown it.
Yeah.
I've blown it. You still get back on the wagon.
I always think it's if you spill a thing, a bit of ketchup on your T-shirt, you wouldn't pour the whole bottle.
Yeah.
So
Yeah.
think of it that way.
Yeah. But it's so hard to do. So stick with it. You do feel better for it, I can tell you that.